the first step of making better health decisions. That's why we give you the health news. And yet after, we go into an expert discussion where we discuss a topic that affects most of us in our communities. And as today is a Thursday, every Thursday we go into a deeper look into the world of mental health, because mental health is as important as the healthy body at large. So stay with us, because we are going to have a deeper look into it, and then we discuss more and see how we can help our everyday lives. To begin with, let's start with our top stories for today. Now, health authorities across Africa are intensifying efforts to contain the deadly Ebola virus caused by the rare Bundibugyo strain, as the World Health Organization warns that a vaccine may still be months away. The outbreak has already claimed more lives in Congo and thus spread into the neighboring Uganda, raising fears of wider regional transmission. And here is more in the report. The World Health Organization has warned that it could take between 6 to 9 months before a vaccine targeting the rare Bundibugyo strain of Ebola becomes available, as the Ebola strain becomes more available, as the deadly outbreak continues to spread in the Democratic Republic of Congo and Uganda. According to the WHO Director General, Dr. Tedros, the outbreak has already recorded around 600 suspected cases and 139 suspected deaths, although officials believe that the actual number could be much higher due to the delays in the detecting of the infections. So far, 51 cases have been laboratory confirmed in the eastern DRC Congo, particularly in Ituri and North Kivu provinces, while Uganda has confirmed 2 imported cases linked to the travel from DRC, including 1 death in Kampala. Speaking in Geneva, Dr. Tedros said that the WHO has classified the outbreak as a public health emergency of international concern, but clarified that it has not yet reached the pandemic levels. Health experts say that one of the biggest challenges is that there is currently no approved vaccination or targeted treatment specifically designed for this Bundibugyo strain of Ebola. WHO's advisor, Dr. Vasey Mothi, revealed that 2 experimental candidate vaccines are under development, but neither has yet completed the human clinical trials. And one of the vaccine candidates is based on technology similar to the existing Ebola vaccine used as the Zaire strain, while another uses the same specific platform as the AstraZeneca COVID-19 vaccine. However, experts say that more laboratory and animal testing is still required before the vaccines can move into wider human trials. Dr. Mothi explained that the most promising vaccine candidate may only be ready within the 6 to 9 months, while another could potentially enter clinical trials within 2 to 3 months if research progresses successfully. Now, the Bundibugyo strain was first identified in Uganda's Bundibugyo district in 2007 and has caused 2 previous outbreaks, one in Uganda and another in DRC in the year 2012. Although the strain is considered slightly less deadly than the Zaire Ebola species, it carries fatality rates ranging from 30 to 50%. And health officials say that the current outbreak is especially worrying because the eastern DRC continues to face insecurity, armed conflict, overcrowding, and weak healthcare systems, making disease control extremely difficult. Dr. Sans Frontiers, also known as Doctors Without Borders, reported that the several treatment centers are overwhelmed with the suspected patients and lack of adequate protective equipment for the frontline health workers. And the WHO says that healthcare workers are among those affected until due to this outbreak, increasing concerns over infection prevention and within and inside the medical facilities. International support efforts are now increasing, with the United Kingdom announcing up to £20 million in emergency funding to support the surveillance, infection control, and the frontline response teams. Health authorities continue urging communities to avoid physical contact, maintain handshaking, and report symptoms early as investigations continue into how long the virus may have been circulating before the detection. Experts also warn that the early Ebola symptoms closely resemble malaria and typhoid, which may have delayed diagnosis during the first stages of this outbreak. Now, the World Health Organization says that rapid detection, isolation, contact tracing, and community cooperation remain the strongest tools currently available as scientists race to develop an effective vaccine against the rare Bundibugyo Ebola strain. Now, moving on to our next story for today. There is a rare relief in the western Uganda after health authorities confirmed that blood samples from the 3 suspected Ebola patients tested negative. And the development comes at a time when the country remains on high alert following the Ebola cases linked to the neighboring Democratic Republic of Congo. And here is more in this report. Health officials in Hoima Regional Referral Hospital have confirmed blood samples from the 3 suspected Ebola patients in Bunyolo sub-region tested negative for the virus, easing fears of a possible outbreak in that area. The suspected patients were isolated after presenting symptoms associated with Ebola, including fever, general body weakness. The individuals came from districts of Hoima, Chikumbe, and Masindi. Samples were later collected and transported to the Uganda Virus Research Institute in Entebbe for testing, where the results confirmed that all the 3 individuals were Ebola negative. Health officials describe the results as a major relief, especially as Uganda remains under heightened surveillance due to ongoing Bundibugyo Ebola outbreak in the Eastern Democratic Republic of Congo. And authorities said that the country is maintaining strict screening and surveillance measures, particularly in districts near border points and the referral hospitals, to prevent possible spread of this virus into our communities at large. The Ministry of Health has continued urging Uganda to remain calm but vigilant by observing the preventative measures such as regular hand washing, avoiding unnecessary physical contact, and reporting anyone showing the symptoms including fever, vomiting, diarrhea, unexpected bleeding, or severe weakness. And the negative results also come at a time when Uganda intensifies preparedness following the declaration by the World Health Organization of the Ebola outbreak in DRC and Uganda as a public health emergency of the international concern. And health experts warn that although the latest suspected cases were cleared, the risk of importation remains high due to the continuous movement of people across borders between Uganda and the eastern DRC. Uganda previously battled a major Ebola outbreak in Mubende and Kassanda in 2022, which claimed dozens of lives before being successfully contained, although through the aggressive surveillance, isolation, contact tracing, and public health awareness campaigns. And medical teams said that rapid detection and early laboratory testing remain critical in preventing panic and stopping possible transmissions. Health authorities continue to encourage the public to stay alert, follow Ebola prevention guidelines, and seek immediate medical attention whenever the symptoms associated with the virus appear. Now, moving on to our next story for today. International support is continuing to grow as countries and humanitarian agencies intensify efforts to continue a deadly Ebola outbreak in Democratic Republic of Congo and Uganda. And the United Kingdom has now announced fresh emergency funding to help stop the spread of this virus and strengthen our response systems in the affected communities. And here is more in this report. The United Kingdom has announced up to £20 million in emergency funding to support the efforts aimed at containing the deadly Ebola virus outbreak affecting the Eastern Democratic Republic of Congo and the neighboring Uganda. The funding will support the World Health Organization, United Nations agencies, humanitarian organizations, and local health teams responding to the rapidly growing outbreak caused by the rare Bundibugyo strain of Ebola. According to the British officials and authorities, the support will help strengthen disease surveillance, improve infection prevention and control, support frontline health workers, and provide life-saving care to the affected communities. Most confirmed cases remain concentrated in Ituri province in the eastern DRC region, and in that region, people there are already facing insecurity, armed conflict, displacement, and also the fragile healthcare systems. The UK government says that humanitarian partnerships operating through the Strategic Assistance for Emergency Response, also known as SAFER Consortium, have already redirected resources towards Ebola containment activities. And these include improving water, sanitation, and also the hygiene systems, and distributing personal protective equipment to the health workers, and also strengthening emergency response measures in the high-risk communities. Additional efforts are now also focusing on protecting maternity facilities and supporting the civil society organizations working to reduce the risk of birth complications and gender-based violence during this outbreak. British Foreign Secretary Yvette Cooper said that the outbreaks such as Ebola remains a global response because infectious diseases do not stop at borders. And she also stressed that acting early is critical to saving lives and protecting global health security. And the UK government also held a high-level cross-government meeting bringing together the Foreign Office and Ministry of Health and other agencies to coordinate the Britain's response and assess the possible risks to the British nations abroad. Meanwhile, the UK Health Security Agency has activated monitoring measures for travelers arriving from affected countries and updated travel guidance for parts of the Democratic Republic of Congo. Authorities say that health officials are working with border agencies and transport authorities to ensure travelers are informed about Ebola symptoms and where to seek medical care if they feel unwell. The UK has also activated its remaining and returning workers scheme to monitor humanitarian workers and medical personnel traveling between Britain and Ebola-affected areas. And health experts continue warning that the outbreak remains serious due to the lack of unapproved vaccines, specifically targeting the Bundibugyo strain of Ebola. The World Health Organization recently declared the outbreak a public health emergency of international concern after cases spread across DRC and into Uganda. Current reports indicate hundreds of suspected infections and more than 100 deaths linked to the outbreak. And health officials said that rapid isolation, contact tracing, public health awareness, and international cooperation remain critical in preventing the further spread across the region. And global health experts say that continued international support and stronger surveillance systems and community cooperation will be essential in containing the Ebola outbreak before it spreads further across Africa and beyond. Now moving on to our next story. As Uganda continues to strengthen public health awareness campaigns, the Ministry of Health is now intensifying calls for Ugandans to quit smoking and all forms of tobacco use ahead of the World No Tobacco Day 2026. And health officials warn that tobacco remains one of the leading preventable causes and causes of diseases and deaths worldwide. And here's more to it. The Ministry of Health has urged Ugandans to stop smoking and avoid all forms of tobacco consumption, warning that cigarettes, shisha, vaping products, and smokeless tobacco continue to silently damage the body and increase the risk of the deadly disease. In a public health campaign shared ahead of the World No Tobacco Day 2026, the ministry emphasized that every path of tobacco harms the lungs, heart, blood vessels, and the overall health. The campaign message, released under the theme "Tobacco Kills Silently," encourages smokers to quit today for a healthier future. And health officials want that tobacco use remains one of the world's biggest public health threats, responsible for millions of deaths globally every year through the diseases such as lung cancer, heart disease, stroke, chronic respiratory illnesses, and hypertension. The ministry also highlighted growing concerns about the increasing popularity of the vaping and shisha among young people, stressing that these products are not safe alternatives to cigarettes as many users believe. According to the World Health Organization, tobacco kills more than 8 million people globally each year, including non-smokers exposed to the second-hand smoke. And health experts said nicotine addiction often begins at the young age, making prevention and awareness campaigns especially important among young people and students. Medical professions also warn that smoking weakens the immune system and increases vulnerability to infections and long-term illnesses. And the Ministry of Health encouraged Ugandans seeking help to quit smoking to visit a nearby health facilities, to contact the ministry toll-free line for counseling and also support services. The anti-tobacco campaign is also being promoted alongside the ongoing national public health awareness efforts, including Ebola prevention campaigns currently running across the country. And public health advocates continue calling for stronger enforcement of tobacco laws and increased taxation on tobacco products, and also tighter restrictions on advertising targeting young people. Uganda is among countries implementing measures under the WHO Framework Convention on Tobacco Control aimed at reducing tobacco use and protecting the public health at large. And health authorities say that quitting tobacco at any stage can significantly improve health, reduce the risk of life-threatening disease, and help build a healthier future for individuals, families, and communities at large. Now, moving on to our last story for today. Health experts in Uganda are raising concern over the growing burden of sickle cell disease after Mulago National Referral Hospital revealed that it registers hundreds of new cases every year. And doctors said that this condition remains one of the leading causes of admission among children at the country's biggest referral hospital. And here is more to it. Mulago National Referral Hospital has revealed that it regrets and registers more than 900 new sickle cell disease cases every year, highlighting the growing burden of this condition in Uganda. According to Dr. Deogracius Munumbe, a consultant pediatrician and sickle cell specialist at Mulago Hospital, the facility diagnoses about 14 new sickle cell patients every week, translating to nearly 960 cases annually. He noted that many young children living with this disease remain undiagnosed due to the limited testing services in some parts of the country. And health experts estimate about 20,000 children are born with sickle cell disease and in Uganda every year, making the country one of the most affected in Africa. Studies also show that nearly 13% of Ugandans carry the sickle cell gene, while about 2% are living with the disease itself. And sickle cell disease is an inherited blood disorder that affects red blood cells, causing them to become rigid and sickle-shaped. And this blocks blood flow, reducing oxygen supply to organs, and leads to severe pain, infections, anemia, stroke, and other life-threatening conditions. So the alarming statistics were reviewed during the commissioning of Uganda's first local hydroxyurea manufacturing facility by the Quality Chemical Industries Limited in Rosila. So this is one of the most effective medicine used globally to reduce the complications among sickle cell patients by improving blood function and reducing painful crisis. Previously, Uganda depended heavily on imported hydroxyurea medication, making treatment expensive for many families. And health officials now hope for local production, and this will reduce lower costs and improve the access of life-saving treatment. Permanent Secretary at the Ministry of Health, Dr. Diana Atwine, described the new facility as a major milestone in Uganda's fight against the sickle cell disease. And she said the government has already added hydroxyurea to the national list of essential medicines to increase access across the health facilities nationwide. Uganda has also introduced mandatory newborn screening for sickle cell diseases to allow early diagnosis and improve treatment before severe complications develop. Health experts continue encouraging Ugandans to test for sickle cell trait before marriage or childbearing to help reduce the number of children born with this disease. And doctors say that early diagnosis, regular treatment, public health awareness, and genetic screening remain critical in reducing deaths and improving the quality of life and the people living with sickle cell disease in Uganda. So to our dear viewers, those are our stories for today. Now we are going to move into our topic that we normally have every Thursday with Mrs. Sozi Becky in Face of Mental Health show. So we, as TV1, we believe that a healthy mind is just as important as a healthy body. That's why we discuss this every Thursday, and to help you get ways to copy, heal, grow, and also live better life mentally and emotionally. So we are going to have that, but before we head there, let's take a short break and then we come back.
Are you ready to build real skills for a better future? Tune in to Skilling Uganda, the show that empowers, educates and transforms lives. From hands-on vocational skills to expert guidance and real success stories, Skilling Uganda connects you to opportunities that matter. Every Monday to Friday, 9 a.m. to 11 a.m. Don't just stream it, skill it. Skilling Uganda, shaping Uganda's future, one skill at a time. Only on TV1. See the difference. Get ready to power your weekend. This is where talent meets creativity, where ideas spark, and where the youth takes center stage. Introducing Youth Hub, the ultimate destination for
anything that is human is mentionable, and anything that is mentionable can be manageable. So whatever you're going through, whatever you think is so hard in your life, whatever you think cannot be handled, whatever you've been through and you feel it's the end of the world, can be manageable. Find time, talk to the right person, talk to the exact person you need to talk to. Find a counselor in your community. If you can't find a counselor, please contact us for your health, because your mental health is your wellness. Good evening, viewer. Welcome to Face of Mental Health, TV1. As we discussed earlier, we've been talking about our children's mental health, and we've really talked a lot. I believe we have a lesson to learn, and today we are going to talk about our human personalities. You may really wonder why people act differently on the same issue. You could be wondering why you receive different responses. Could be on a certain problem, and for example, a family might lose a loved one, a parent dies, but then amongst the children or the relatives, one gets hurt more than the rest. Does it mean that this person was so much attached to the person they've lost? Does it mean that this person is so delicate? Does it mean that this person has lost hope? At times it's not the case. At times it's related to our personalities. When you look at me, when you look at you, we have different personalities. Today we are going to digest, we are going to look deep into our personalities. Find where you fall. This will help you so much to mingle or to talk or to handle issues or to know how to go about certain things without hustling, without even straining so much, without wondering why it's happening to you. Today, get to know your personality. You need to know who exactly you are. You need to know how you feel about certain things. You need to know the risks you're facing, and then you need to know your strength. Today, we are going to start with the choleric or the doer. When we talk about the choleric personality, what comes in your mind? A person with a choleric personality, these are doers. Are you a person, you're born a leader? They are doers. They don't wait for others. For example, you might compare this with your siblings, the families you've grown up with. We end up having people in our families who are flexible, who can do everything despite how hard it is, despite how lazy they can be, but then the personality leads them into this. The choleric. These people are doers. These people are born leaders. Leaders automatically. We look at kids in schools, and then you bring a child at school, they're like, who wants to be a class monitor? They raise up their hands. Very fast. First day of the school, she finds people who have been there like for 2-3 years, but then she ends up feeling comfortable and free and already used and already confident to be their leader. So if you have that element in you, that wherever you are, you're noticed very fast, you feel you can do things that you don't even know about, you're a choleric. You are a doer. For you, you don't wait for people to tell you to do something, you do it immediately. They are controllers. When we talk about a choleric, look at yourself. Do you control everything? They feel they want to control everything. For example, at homes, look at our children. Maybe it's the only way you can understand these personalities. When you look at the children at home, there are those children who want to keep law and order. They are your policemen at home. And you're like, if Becky is not there, things will not be well. These are choleric people or choleric children. They don't wait. They put everything in order. Even if their siblings refuse, even if people around your workplace refuse to do something, you're good to go. You do it, you do your work, and you do other people's work. However, these people have their strength. They are so passionate. They do things passionately. They don't, because of their personality, they don't do things forcefully, or I have nothing to do. They don't complain. They do things passionately. If you're one of the people who do things passionately, however big they are, you're a choleric. Then they decide, okay? They decide immediately. They don't wait for other parties or the second party. They don't wait for the second voice. No way. They decide on their own. Another thing, they're independent. They are independent. If you're independent, you're a choleric. You find a kid, as young as they are, you go into a new place, or a human being, they go into a new place. This person finds where the loos are. This person finds where the cafeteria is. This person finds where, for them, they are independent. You don't need to, for example, they're serving food. This person will not wait for someone to help them get food. They'll be like, okay, are we getting food? They're good to go. If they are kids, they'll help themselves, going to the loos, having something to eat, relating with others. They are independent. And these people are highly organized. If you're a choleric, you must be highly organized, because you have no reason for not being organized. First of all, they do things willingly. They want to do things as they are. They don't wait for others to tell them to do something. So they are highly organized. And then they are excellent in crisis. When trouble comes, they can manage crisis. They can calm themselves down. They can talk to themselves down. They can They can adjust to crises. For example, if they happen, you may have a crisis at workplace and then they're cutting off some workers. Even if they cut that person off, even if they tell that person with immediate effect, stop working, we can't continue with you, this person will be like, okay, it's okay. It doesn't mean they're not hurting. They are really, really, really hurting so much, but they're immune, or they're excellent at crisis. Despite all those strengths you, a choleric, might have, they have weaknesses. They are very impatient. Very impatient. So look at yourself. Are you impatient? For example, you might go into somebody's home when you're choleric. When you happen to find dirty plates in the sink, they will not wait for anybody. They will start washing the plates, despite the fact not minding about other people's program in that family. They're impatient. They can't take the mess with them. They can't tolerate. For example, they're in the audience and then someone is making funny jokes. They can't take the patience. They feel they want to go and correct things at the stage when even they are not leaders. They want to stand up there and talk about what is not right. So they are very, very impatient. They are stubborn. If you're a choleric, you are very stubborn. Check yourself. Stubborn behaviors could be in dancing, could be in singing. They give jokes stubbornly, like it is really happening to the choleric. So if you have those weaknesses, you're a choleric. If you're impatient with certain things, you can't accept things to go wrong when you're watching, you're a choleric. Then when we talk about someone being stubborn, still those are the choleric people. They are short-tempered. They always regret, I wish I couldn't do this, I wish I didn't say this, So if you happen to face that issue of being hot or short-tempered, then you're a choleric. When we talk about this, it doesn't mean that I'm supposed to be a choleric, I'm supposed to be this. No, we are created differently. We have different genes. We are from different planets of the world. So, dear, in case you have any questions, please you call on 0755 17 60 30 or 078252 4953 for any questions if you really want to find out your personality. Then if we go to the second personality, it's called the sanguine. The sanguine. We have the sanguine personality. The sanguine personality, these are people who influence, that they are the influencers. Have you ever done something when you are not going to do it if someone had not influenced you? Or have you met these people who influence, and when they try to influence you, it's a must, it's a yes for you. They are influencers. These people have their strength. For example, let's talk about a party. They bring life to a party. When this person comes in, if you're that person who comes into a party and they're like, yes, now everything is okay, you are sanguine. They bring life to a party. They bring life to everything that is dying off. Could be church, could be music, could be, name it all. Are you that person? You are sanguine. You are an influencer. Then they are highly social. These are people who can relate with anybody, despite how hard that person is. They relate so easily. They are friendly. They are loving. They are easy to relate with. They are too social. Are you social? You are a sanguine. Then they connect easily. They connect easily. You just point where you want that person to be, and then that person is like, is that where you want me to be? How many minutes are you giving me to be there? How do you want me to be there? Okay, then I'm good to go. they will just go. They are so confident and they are easily connected with different people despite other people's personalities. When we look at their strength, they are very, very creative. Very creative. Actually, they bring things out of nothing. They can find, as we said, they bring life to a party. You might be like, oh, what are we going to do about this? We are stranded. They always have a solution to everything. They're so empathetic. They are very kind. They feel pain. They wear the pain. If they happen to meet someone who is going through through happiness, they smile with them. If they happen to meet someone who is crying, they'll easily cry with them. So they are very empathetic. They are outgoing. They don't deal with boredom. They don't deal with silence. They don't deal with idleness. They are outgoing. Can we go there? You guys, I think we should. They always organize the parties. They bring up occasions. You guys, it's been so long since we did this. They are those kind of people. You are sanguine. If you're that kind of person, you're a sanguine. Yes. And then they really motivate others. They really motivate others. Where people are losing hope, I've met somebody, and every semester at campus, this person was there to motivate others, and every semester there would be someone who would really want to fall out, someone who would really want to give up, but then this person comes in, you guys, we need to do this. Despite even that very person getting down, low moods, this person brings up others. They are good at motivating. So if you're good at motivating, you're a sanguine. From today, know you're a sanguine. And then they have weaknesses. After these weaknesses, we are going to have a short break, then we shall come back with the other personality. They have weaknesses. They are easily distracted. If you're near these people, or if you have children who are sanguines, they are easily distracted. For example, they can easily relate with bad groups. They can easily relate with wrong people. So it's easy for them to be distracted from the right path. When they find drunkards, they want to socialize with the drunkards. They don't have that second thought of what I'm doing is not right. They'll just go for it. So if you have a kid, or you have a child, or you have a teenager who is a sanguine, get note of this. This person is easily distracted. Then they are chronically disorganized. When we talk about being disorganized, they forget appointments. And it's because they have a lot. They have a lot. For them, they go with what is going. They go with what is moving. If you're going for that party, can we go now? Yes. Not forgetting they already had an appointment on that very day and time. So if something comes up, they are good to go. So if you're that kind of person who forgets appointments, please, you're a sanguine. You have no crime in that. That is who you are. And let me tell you, you cannot change your personality. These people, they make immediate decisions, which is at times not good. Immediate decisions. That is why they get disorganized. Yes. They agree on appointments before looking at their calendars. Just like I've said, when they say, you guys, can we go for the party tonight? They can't even forget they have a sick person at home, and then they accept to it. And then that makes them a bit more disorganized. So if you're that kind of person who moves with what is happening immediately, you come up with what has just come up, you just agree to anything that comes up, you're a sanguine. That is who you are. So if you get to know who you are, it's easy to relate with others. They interrupt conversations. Those are some of their weaknesses. Before even the statement ends, for example, in relationships, for example, in families, you might be talking about something. This person comes in before even you end, and they already have the answer. So they really interrupt. Please, if you happen to meet such a person, don't just get nagged. Just know they are trying to be who they are. They are sanguines. Then they struggle with follow-throughs. At times, these people are good at bringing up ideas. They bring up ideas. If you are one kind of person who brings out ideas, and then you, at the end of the day, you fail to go at the end of it. For example, they are very good at idea bringing, but then putting it into action might be bad. They are very wise people. They think so fast, but then they don't have time to wind up. They are good at starting and they have brilliant ideas, but bringing them to reality, bringing them to existence, it is really hard. So if you're that kind of person, you need to find out the real people. Maybe you get a choleric, and then this choleric comes in to help you. You bring up an idea, and then for them, they build it. Yes, they can at times write a book, one chapter, and then they don't continue with the second chapter. After 2 weeks, like, oh my God, I was writing a book. That is not a weakness. It is just a personality. So after this break, we are going to come back for yet another personality. Don't forget, your mental health is your wealth. Without a stable mental health, you cannot reach anywhere. You can't do anything for your life. We shall be right back.